is I help people find healing and well-being through relaxation and release of tensions in their body. Okay? And I do that through a few different healing modalities. And they're all hands-on. All the things that I do are hands-on. And so when you come for a session with me, you lay on a table, fully dressed, and you just be prepared to relax, all right? And there's so much healing in relaxation, okay? And so you might come to me because your knee hurts, or your shoulder, or maybe you've been having headaches. Maybe you have some digestive issues, certain things like this. These are reasons why people might come to me, amongst many others. And if you look at those brochures, it lists all the different things. You don't have to look at them now, you can look at it later, but it lists a lot of different reasons why somebody might want to come and have a session with me. So the first modality that I use is called craniosacral therapy. And you guys have a sheet. I've passed it out. It looks like this, and it says it at the top. Craniosacral therapy, right? There it is. I know that's a tough word. So let's look at it and let's say it together. Craniosacral therapy. All right, now we got it. All right. So you're still looking at that paper. Just some things that I want you to pull out of there is that it's a light touch practice. All right. And so what that means is I start off with the pressure of a nickel. All right. How many of you know the actual weight of a nickel? It's 5 grams. All right. And so think about that. That's how much weight I'm using, starting off with. Sometimes the body will need a little more pressure than that, but I start off with that light pressure. And it's incredible because the body responds very well to it. It's such a natural weight, and the body is just like, oh, somebody's got their hands on me, you know? And so what I do with that weight is I help the body to heal itself. Our bodies have a cellular intelligence. And so what that means is they're smart. Our bodies can heal themselves, all right? And so sometimes they just forget how to do that. And so what I do is I just nudge the body a little bit and just say, how about if we move this tissue into this area, very gently? And the body's like, hey, good idea. I should have thought of that, you know? And it's like, well, maybe if I'm gonna do that, maybe I could do this too, you know? And so I just nudge the body, I facilitate, I'm a helper. Your body is doing all the work, all right? And so it works with the body's craniosacral system. Now basically what that is, and also with the central nervous system. So basically I work with the head down to the tailbone and basically anywhere on the body. So, and what it would look like is I might have my hand on top and underneath, maybe your arm or your hip or your head, okay? And I might be lengthening and just opening and relaxing. So I'm supporting and nourishing the central nervous system and improving overall health and well-being with craniosacral therapy. It works with the rhythms in the body. You all know about the cardiac rhythm, right? The heartbeat. There's another rhythm that hardly anybody knows about, and it's only been recently discovered. It's called the craniosacral rhythm. And where that rhythm comes from is it's when there's a mechanism in the brain that pumps craniosacral fluid along your spine down to the tailbone. And so I can feel that rhythm anywhere on your body. I've been trained to have very sensitive hands. And so I listen using that rhythm. And so I can access, your body will tell me, you know, the rhythm is down in the shoulder. Okay, so we need to work on the shoulder a little bit. Or you might have pain in your right hip. But we might end up working on your left shoulder. It's crazy, the whole body, it's all connected, you know? So, and it helps to alleviate aches and pains and strains of life. And what are strains of life? Just everyday tensions. You go outside and it's cold out. What happens? Our shoulders go up to our ears, right? Or, you know, I sat and worked at a computer for many years. And look at, I have a nice little line between my eyes right here. I looked at the screen like this for so many years. And so it just improves the body's ability to self-care. And that's really what reflexology. Raise your hands if you've heard of reflexology. Okay, and no big deal if you haven't. It's not something that's really out there. It's an alternative practice, but it works with the bottom of the feet. And so basically I rub the bottom of your feet. There's certain points on the bottom of your feet that go to the entire body. So the entire body can be accessed through the bottoms of the feet. Also sometimes the hands, ears. I don't work so much with those. I mainly work with the bottom of the feet and bare feet. And it promotes relaxation, circulation, and stimulates the glands and the organs. So it can balance out your hormones and just make you feel really just generally good. My husband, he's sometimes not into all of these alternative things that I do, but you know, he's like, just rub my feet, do that thing on my feet. And I said, why do you like it? And he said, it just makes me feel good. So, I mean, that says it all right there. So, and then the other piece that I do is access bars. And this is also something that you just lay on the table, and it's very relaxing, and it can open up restricted areas in your life, honestly. It can work with aspects of your life, not just your body. It does work with your body, but it also can work with your life and energetics of different things, relationships, or in place where you're holding stress or tension. And it can open us up to receive abundance, positive change, and overall well-being in our lives. And again, this is very relaxing, and if you want to know more about it, come and try it out. Come and try it out. I just want to give a little shout out to Sandy Feldman, who also has a booth out here. She also does access bars. And she is going to be, she's teaching it. So all of you, if you are interested and you want to learn more, you want to learn and be able to do access bars yourself, it's something we can all do. So Sandy's going to be teaching a class on March 2nd, and it's at Tony's studio, actually. So, so a little bit about the last thing that I do, and that is yoga. I teach yoga here in Olivia at Tula, which they also have a booth out here. Tula does, and they're right down here on Main Street in Olivia. And their fitness center, they do everything from cardio core, they do fit classes. I teach the yoga classes, and Susie Lang, who's here, she also teaches there, and she teaches yoga as well. And also I do chair yoga classes, which are wonderful and relaxing and helps you breathe and release tension.
Chet Bowen is my dad, and if I go too long, we'll be talking about the Gopher basketball game. We gotta keep on track and make sure that we're talking about acupuncture and everything else. That I'm trying to give you guys as much information as I can in a little time. But thank you to Sam and RC Hospital in the foundation. The wellness that's coming up is awesome. So we're really excited. I know all the girls are excited too for what's coming up. So thank you for having me speak. Like Sam said, I'm Craig Bowen from Olivia. I've had an office here in town for about 7-8 months where I just do acupuncture. Also, I'm over at Health Enhancement, been there for about 8 years. I've been out of school for about 18 years and actually got my master's degree in the cities at Northwestern Health Science University, an acupuncture clinic, or acupuncture school there. I kind of started my own office here in Olivia for the fact to do more traditional acupuncture with people. A lot of times over at the clinic in Bird Island, people needed to get adjusted in order to see me, and I didn't find myself having enough time with them. I wanted to spend more time with people and really find out what was going on, how I could help them. I find that people being able to talk to me, let me know what their problems are, is therapeutic in itself. So to have an atmosphere like that, I think is huge. So I'm really excited to be over at this little shop in town. It's nice and quiet, and my goal when you go there is to be relaxed when you leave, not hearing people talking. So it's been working out really well. I have a wife, Chrissy, that works here at the hospital, and a daughter, Riley. She's 13 years old in 7th grade. That support me quite a bit because I'm not home very much. One thing they haven't been shoveling for me, well, that's okay. But everything else has really been helping me out a lot with me doing both things. I'm here to talk about acupuncture, and a lot of times people say, oh, I've heard it's so good for stress. I got so much stress. Well, who doesn't have stress? I got so much anxiety. I just get so wound up when I have something coming up and I just get, It's true. Acupuncture is very good for stress, anxiety, depression, things like that. And I see a lot of people for that, and I see a lot of success with it. But it reminds me of a story of this boy named Jimmy, and he did not like school at all. And he'd sit up in his room, and his alarm would go off, and he'd hit the snooze. And he was awake, but he did the snooze, so his mom would hear the alarm. 10 minutes would go by. I think that's how long snoozes last, about 10 minutes. And he hit the snooze again. This happened about 3 times. And he's like, I think I'm going to get away with it. I don't think my mom's going to hear me. So he's laying, all of a sudden he hears the mom walking across the steps, or across the kitchen floor. And she gets down to the bottom of the steps. She's like, Jimmy, you got to get to school. Wake up. He's like, Mom, I don't want to go to school. I hate that place. The kids are mean to me. The teachers don't like me. The custodians don't like me. The lunch ladies don't like me. Nobody likes me there. I don't want to go. She said, Jimmy, you got to go. You're the principal. So it's all ages. We see adults, kids. Everybody has stress. And there's just things that we have to do in life that we just got to do it. So acupuncture is one thing that you can do to kind of help you through that, along with even some other medications possibly that you're taking, so that they're working better for you, so you don't have to take so much of it. So it can kind of work together too. I talked about Jimmy. Things are really getting prime time with acupuncture and other alternative cares, but really this stuff has been around for a long time. They say 2,500 years that acupuncture has been around for. And actually they think it's been around for even longer than that from some things that they found in the Alps back in the 90s. This guy had some tattoos on him and stuff. So it's been around for a really long time, and sometimes they call it TCM. TCM means traditional Chinese medicine. So if you're out and about or reading an article, and you hear TCM, that's acupuncture. Sometimes it's herbs, other different modalities that they use in China. So it's something where I use cupping, needles. I was just going to pass these around. I have different sizes. But what I use, which is a little different back in the day when I got into this, because I had a lot of it done on me for different injuries and things over at Health Enhancement, which was Nybauer's, I think, Nybauer's chiropractic then. So it kind of sparked something to me when I went to school. I'm like, I'm going to try this out and see how it works. It worked for me. Then they use autoclaves. So they would clean the needles in this big autoclave and heat them up and then reuse them. Now we don't have to worry about that. Now we have needles that come individually wrapped, and so we can use these needles and then we dispose of them right away. So as far as the safety of it, very safe. You don't have much for infections or anything like that. You don't have to worry about that because once they're used once, we trash them. We put them in the sharps container. So if you want, I'll just pass these around. And like I said, I have all different sizes, ears. Depending on where you're putting the needles at, you need different sizes so that you can accomplish whatever your goal is. 1940s, I think it was, 1941 is when acupuncture started making, or TCM, started making its way over to the United States. Probably more on the coast. It gained a lot of popularity out there, but hasn't really mainstreamed here for a long time. Now it's starting to go that direction a little bit more. Research is showing that it's really good for low back pain, neck pain, arthritis, knee pain. Even doing some research on my own recently, looking at people post-operative with knee pain, doing acupuncture along with maybe some of the pain medication or some of the modern techniques that they do here at the hospital works really well. Especially with the opioid crisis that we have going on, it's gained a lot of popularity, a lot of alternative medicines are. So because of those things, it's become really popular out here now in the Midwest, so it's starting to gain, and Tony and I were just talking about that before this. It's starting to come in to where when we got out of school for this, we were hoping it would be like this then. But it's taken a little bit of time, so we just had to be patient. But the big part of it is just educating people as much as we can. And Tony had mentioned it too, and I'm sure Angela would agree. Educating people is awesome about this stuff. Trying to let people know what's going on, how it works, and that's what I'm going to try to do today a little bit. I might need some volunteers. I'm not going to stick needles in you, but just to kind of give a general idea how things work with this, we're going to try to make it really simple. The cool thing about it too is that everybody responds differently with treatments. It's not a cookie cutter stamp when people come in. I could have a couple people come in with different things or the same things, but treat them differently. So that's the really uniqueness about acupuncture. Everybody responds differently. And it's one of those deals where I try to take time, like I said when I started, to sit down and get a history with people, find out what their complaints are, look at the family history a little bit, and see maybe if there's some past family history of something going on. And a lot of times people tell me so much stuff. And I think it was Les Brown, who I don't know who Les Brown is. So I used to do this at a different talk. Les Brown said, it doesn't pay to complain. Because 80% of the people that you complain to, they don't care. The other 20% are glad it's you and not them. But in my office, I want people to complain because the more you tell me, the more I can help you out. The more I can figure out what the root problem is, and I can help you out. And I think people like to complain. They like to tell people their problems. And that's why I wanted to have more time to spend with people so they could complain to me. A lot of people sometimes get ashamed if they're saying, well, I did acupuncture, I did all right, but also when I did this, all right, I went and tried this person over here. I had a massage done too, is that okay? That's awesome. All I want to do is to try to help people out. If I can have a hand in it, great. Whatever you got better with doing, as long as you're better, that's our main goal. If it was me that helped you out after your surgery or before surgery before it went better, if I maybe helped to loosen some muscles up before a massage or another technique that you're having, awesome. That's what our goal is. I'm not going to hang my head and be like, oh, you had a massage? I thought we were going to do it just me. And then I was going to treat you. Come on. No. Whatever people, I really want to work with whoever else they're working with, other practitioners, and that's really been a goal of mine, is to work alongside other people. I always tell people, all I'm trying to do with your system is put some training wheels on it. We're putting some training wheels on you. I'm trying to help you however I can and giving you a little push until you get pedaling fast enough, then we'll take the wheels off and let you go on your own. Let the body do its own thing. Let it heal itself. But sometimes things happen through life. We have stressors and things like that. There's a lot of things that can create this disease through our lives. Diet, stress, environment, toxins. So if we can try to get the body to cope with that stuff better, then you get off on your own and do your own thing. My goal isn't to keep on treating people. I don't want to. I think that the best patient I had, I don't think she's here. The best patient I remember, this is about 7 years ago. She came in for a visit, and I sat down and I talked with her, and I said, you know what? I said, you're doing really good. She's like, yeah, I feel really good. I'm like, I don't think we need to do anything today. I said, get out of here. She's like, are you serious? I'm like, yeah, we don't need to treat you. You're doing fine. That was the happiest she's ever been, because somebody told her she was good, and she didn't even need to get treatment. And I was fine with it. It's like, that's what my goal is to get people better. If it means ending our treatments, that's what I'm all for. Stress, anxiety, depression, sleeping issues, insomnia, whatever it is. Like I said, we're talking with people, trying to find out what the root problem is with them so that we can fix it. The more I know, the more I can help people. When I say the root problem, you treat the root with acupuncture or traditional Chinese medicine, then hopefully everything else just kind of chips away until we get to the point where you find that thing that's really bothering you, what you came in for. And sometimes that will go away right away too. But even treating some things, like the spleen, for example, in Chinese medicine, they say the spleen, which is very common here in the U.S. because of our diets. We're always in a hurry, we're in a rush. We don't take time to chew our food 100 times, which who does? You know, that's a lot. But I think the Chinese say to chew it 100 times so that you don't eat so much. You get bored of chewing and you just quit. But to break stuff down and take your time. What the spleen helps to break down food and then transport the energy of that food to all the organs. All right? So people that come in with fatigue, or maybe they bruise a lot, or they sleep terrible, or when they sleep they dream a lot. Maybe that's what they're coming in for. And then maybe a couple of visits they're saying, hey, I'm losing weight. And that's not even what we were trying to do. I'm like, yeah, well, that makes sense because your body's working more efficiently. It's doing what it should do. So you'll maybe start seeing things like that. Even though that person didn't come in and say, I want to lose weight. You know? So you start seeing and chipping away at things that maybe you didn't even expect to gain some progress on. Which is fun to see people get surprised. And they always ask me, did you know that was going to happen? Well, I was hoping it would. You know? That's awesome. If that's what you want to happen, awesome. One thing with stress and anxiety, depression, now is the time, this winter has been a nasty one. It's been a tough one. Well, it's winter, we're in Minnesota, what do we expect, all right? It gives us something to talk about. I mean, what are those people in Arizona talking about? 70 again, you know? Well, it's sure dusty out. But this is a time when, it's a time of rejuvenating, of resting, letting our bodies recoup. So if you work out a lot, or always have worked out a lot, and now you get to a time where you're like, I just don't feel like doing anything. That's normal, according to Chinese medicine. This is a time that we're supposed to let our bodies relax and recoup and get ready for the spring. A lot of people come in, they get depressed or sad because they don't have the energy to go work out anymore, or whatever it may be. That's normal, so don't feel like that. Maybe you gain a little bit of weight, that's normal. Your body's just building up things. So don't get down in the dumps. I always have to tell people that, especially this time of year. This is the time that we're supposed to kind of gear down a little bit. So don't get in the dumps if that happens. Just wanted to put that out there so I don't have to ask some questions. The theory of acupuncture. I don't know how am I doing that. About 2 minutes, that's it. There's 350 points on the body. There's 12 meridians on the body. There's the gallbladder, there's a liver, there's a small intestine, there's a heart, spleen, stomach, lung, large intestine, kidney, bladder, pericardium, sand jaw, all these different organs all have their own little pathways. And that's when you look at a chart of a body with all these points on it and all these lines, that's what those pathways are. So what the goal of acupuncture is finding out what the problem is, picking between all these points, and maybe even combination of points, using these cool disposable needles that aren't going to give you an infection, and treating the body individually with each person. The goal is to get qi and blood. Qi and blood, according to Chinese medicine, is our vitality. That's what makes us work. The blood holds the qi, and the qi moves the blood. If you work on one, you have to work on the other one. All right? A lot of times when people are deficient in one, then they'll start seeing different side effects of it. Especially if it's going to one particular organ is deficient, then that's what you have to focus on. I do this by looking at tongues, at pulses. I'll check pulses, not just if you have a pulse, which is good, but I look at different levels of a person's pulse, if it's really deep or if it's shallow. If it's really deep, it's more of a chronic thing. If it's really shallow at the top, it's more of an acute thing. Look at the tongue. If it's swollen, there may be something going, a lot of dampness going on. If it's thin, there's just not a lot of energy there. So if it's quivering, there's all kinds of things that tell me how you're doing. So I don't have MRIs or any fancy ultrasounds or anything like that. So when I usually tell people for the first time, stick your tongue out, they look at me a little corny. But the big part of it is to educate them as far as what I'm looking for. Once I tell them what I found, I say, go home and look at your tongue now when you get home, so you can kind of see what I saw. And then you can kind of look at the changes. If it's purple, that's telling me that there's stagnation. There's not much blood moving. So we gotta get things moving again. So I try to educate as much as I can, which I'll finish up, which I think is very, very important. When people come in, I ask what their goals are. I look at their goals are, what they want to accomplish. I tell them what I think they need to work on, maybe some dietary changes. Get everybody on the same page. The mind is very powerful. If you don't think you're going to get better, you're probably not going to get better. A lot of husbands, not a lot. A couple husbands come in and say, my wife told me to come in to quit smoking. And I say, well, do you want to quit? No. I'm like, well, it's not going to help you then, probably. I'm just going to be honest. I can take your money, but this isn't probably going to work. All right. I told her I stopped. You know, so it's very important to educate people on what our goals are, what our plans are, educating what I'm feeling with their pulses, so they have a little bit of a clue and idea what's going on, what we're trying to accomplish with this. It is some corny stuff. I'm not going to disagree. It's some really corny stuff, and some stuff I keep to myself and only give you a little bit of it because you probably look at me like I'm crazy. But for the most part, I try to get it so you understand what we're trying to accomplish with it. And if I can get you, the patient, and I on the same page, it seems to be very, very successful and exciting for everybody. It's safe when it's done right by the right person. Very minimal side effects as far as infections and things like that because of the needles. Disposable, get rid of them right away. Effective treatments, even with modern modalities. So we can do both. If you're taking a medication or taking a pain medication, we can do both, so you aren't taking so much of one to help you wean off of it maybe a little bit in the future. But also people that maybe can't take medication, it's a good alternative to look at. So that's like, hey, at least I have something I can try. And that's what I want to be for. And it's also cost effective, not real expensive. If anybody has any questions, they can ask me about that. I don't take insurance, but I try to keep my prices low enough for that reason, because I understand we pay premiums. So I try to keep my prices low enough to where I can be consistent with care with people, but also get the effects of it, but that it doesn't deter people from coming and seeing me because of the price. So they're about 40 minutes to an hour treatments, because I spend time talking with people. If you're doing really well after the first visit, for example, I won't probably change anything. There's no point in changing the treatment if you're doing really well. If things aren't changing, then we have a different plan of attack and go at it a different way. There's a lot of different things we can do. To finalize, I appreciate being here, Sam and everybody. Appreciate being here. And if there's any questions at the end or outside on the booth or in your questions that we ask everybody, I'd be glad to answer any questions.
As Tony for years, but my real name is Antonine, and that's the name of my business, Antonine G. We all have feminine divine energy as well as masculine divine energy, and I would say the feminine is really strong today. Within my business and within my personal goal is to love, to create, and to empower both myself and other individuals. And I am what's called a seer. Many of you are very familiar with the psychic. You've seen the psychics on TV, where psychics they have this wonderful gift of being able to have people connect with their loved ones that have transitioned from this life to the next. And psychics a lot of time will see a symbol, or they'll see a color, or something like that. The difference with a seer is a seer will see a whole scene. They'll see the details of a scene. They'll see the events that are taking place. And that's what I do to help people find wellness. Many times we have a source of dis-ease or a source of something happening in our lives. Let's say that you're a person who is always having a job challenge, just can't seem to keep a job, or the job you have isn't quite the right job. Or let's say you're a person in a relationship and you seem to be doing the repetitive thing with friends and different things like that. You could go to a person who's a seer, and I would help you get back to the source or the event that happened, and then you would heal yourself of that event. So that what happens then in your life is your life filters out from that and things change for you. Where I first came to realize this was when I was doing my yoga teacher training and I was introduced to Reiki. And Angela is also a Reiki master. Reiki is a hands-on modality where the energy, universal energy, is transferred through your hands to the client. And so I was doing self-Reiki. And so I came like this and I was giving myself self-Reiki. And all these scenes in my life started playing out. I was little, I was at my grandparents' place. I was older. Just all these things started playing out. And I started to realize that we keep those with us, those memories. Happy memories, as well as challenging memories. So then it was like things just started to unfold. And I started to realize that there could be a source of that hold or a source of something. Because I found as I was not speaking my truth, or maybe many of you in your job situation haven't felt like you could speak up, I noticed I was getting a cold or a sore throat, that I was holding that energy of my truth or what I wanted to say within my body. I also was making the transition from graphic design. And that was kind of hard to let that go. And I was kind of had my feet stuck. And I noticed that my heel, I was having a lot of heel pain and plantar fasciitis. And so I came to realize so much that our body is speaking to us all the time. Our body is telling us its needs, its wellness, that wellness comes from inside out. And so with that, it opened up a whole new door of understanding, a whole new door of study. And so I went on to study how I could help people. And so that's what I do as a seer. I help people get to the source of the event in their life to help bring wellness to their life, to help bring a change. I also do it for businesses. I'll have business people throughout the United States call me, and they want information as to why a particular deal has a block in it, why things are not working out, or maybe a piece of land they want to buy is not working out. So they'll call me to read the energy. We all have energy. We all are energy. And our thoughts vibrate out an energy, and we bring that energy back. So that what I see is the lowest of vibration sometimes. Guilt, shame, grief are down here. And the highest is enlightenment and bliss. And so by helping to release those either through acupuncture, through hands-on, through seer, through different things like that, we raise our vibration and raise our wellness. Take for instance food. We all love food. Food's wonderful. We live in the land of plenty. We're so very blessed. I love food. But yet we're made to feel bad, you know, about what we eat or how we eat or do things. And so we're taking that vibration in. And the biggest thing for us is that self-love, that loving yourself. And loving yourself is about taking action, doing different modalities, whether it's coming to a medical facility for your health, whether it's doing what you love or eating what you love, just raising your vibration and raising your levels. So I'd like to have a volunteer from the audience. I just want to break the bond. It's not gonna be scary. Okay. Any of you, what I'm gonna do is we're just gonna, this is a pendulum and I know it might seem a little scary to people, but how many of you when you were in high school put a paper clip on the end of the string to see how many children you would have? Did it work? Yeah, okay, let me hold my hand up on this one. So I'm gonna give her something to do. Okay, so you're gonna face the audience. And do you have that in your mind? And I just want you to resonate with that and think about that. Just think about it. And how much you do. Okay. Now I want you to clear, I want you to think about ice cream, potatoes. Pizza. Oh, oh my gosh. I love pizza. Okay, so clear your mind, okay? how then thoughts, they resonate with us, they vibrate with us. And we as women, I think, and men too, I think what happens is so many times is that we're taught to give and give and give and give, but we also need to do self-love. We also need to do that wellness, and in that wellness comes healing, all types of healing, for our body, for ourselves, for us. So I'd like to take a couple minutes. I always like to teach something. So I'd like you to take a couple minutes. I want to teach you what is called a Soham meditation. And this meditation is fabulous for stress. You can do it anytime, you can do it any amount of time. We're going to do a short one. And we're going to be bringing in our pranayama, or our breath, into our body. Our breath cleanses us. Our breath heals us. And so as we take an inhale, if you really listen to your breath, you hear a so. And as you exhale, you hear a hum. Or hum, depending on your accent. So I'm going to have you close your eyes. And let's bring awareness to your beautiful body. Your body that is here for your journey in life. That's carried you a million miles and a million more to go. And on your inhale on so, I'll have you in your mind think I am. And on hum, when you exhale, that. And inhale, I am. Exhale, that part of the universe I am. Inhale, so. Exhale, hum. Inhale, so. Exhale, hum. Let's do that for a couple more minutes. Just letting your body relax. Letting go of any stress. Loving who you are. Creating wellness within you. Creating joy. I am that. I am that. Okay, I'll have you gently open your eyes. And how do we feel? ¿Un poquito? So that is what I do. I help people get back to the source of their dis-ease or the events in their life so that they can heal themselves. That wellness, bring that wellness forth. If someone believes in multiple lives, I help them with that also. And I came to be a seer as a child. I was always the one, my family was having fine things.